All right. Well, this is awesome. We're live at HIMSS in Vegas, and I'm super excited. I'm with Christopher Kunney and
Dr. Patricia Marsh.
All right. Awesome. Yes. Take it away.
Yeah. Well, again, we're back here at HIMSS 2025, and I have the pleasure of working with this amazing doctor and technology entrepreneur, Dr. Patricia Marsh, who is the founder and CEO of Ask Me Your MD. It is an amazing, affordable platform for virtual care. I'll let her give more specifics behind the impetus behind starting this amazing platform, and just share a little bit more about why she's here today as well.
Yeah, so my path into technology is kind of one that I grew up with. My dad's a software engineer, and so we had all of the latest gadgets in our home.
Right.
There was like a computer for literally all 6 of us. And so I grew up playing Math Blaster,
Right.
Learning how to type, learning how to code in DOS.
Right.
My dad would have a motherboard and show me how things were connected. And I didn't know at the time that it would follow me after I finished my medical training.
Right.
I was just going along my medical training, and my best friend, she comes to me after we graduate, and she's like, I want to start a business.
Right.
And at that time, I had app ideas in music, because I'm also a musician. I'm the world's famous queen of karaoke. And so I was dealing with, technology in that industry. And so she said, I want to make the world's best doctor chat. And I was like, oh, that's a good idea. But, I was building my other platforms. And so lo and behold, a few months later, my dad was hospitalized, and I was in the hospital with him. He had an emergency. And I thought, oh my goodness, if I hadn't been there, what would have happened? And so I went back to my friend and I said, you remember you wanted to make this platform?
Right.
And she had already started on making a platform with another startup with a similar idea, but they were looking at health literacy. And I was like, no, we need to switch back and make this accessible to regular people who don't have access to physicians,
Right.
to make sure they have someone there that's reliable, and we can text back and forth with them and have our doctor chat that way. Lo and behold, at the end of 2021, we made Ask Me Your MD.
Exactly.
And we started with just the 2 of us as the physicians. She's in internal medicine, I'm family medicine. So we could provide care to just about anybody that
Right.
had questions.
Exactly.
And we decided to expand it to open up to care. Because we found in that first year of opening up the chat that people needed access to care. And that was the story. And so that was the real underlying problem that we started to solve.
Exactly.
So you're solving that 168 or 167 other hours of that week where what do I need, doc? Help me out, and I can't get in or whatever. So really that
Exactly.
asynchronized care, like telehealth 3.0 where it really
Exactly.
should be.
That's right.
Exactly. And I'll be talking later today at HIMSS
Yes.
about the case study where we had a 99-year-old gentleman who's being, taken care of by his daughter. And at 4 o'clock in the morning, she had questions,
Yeah.
and he had issues, and we were there for her. And so it was with that power of just a text-based platform that we were able to give her peace of mind. We were able to reassure her of the, realm of safety for her father and keep him alive from going back to the hospital.
That is awesome. So you're live now, and are you do you have to be the primary care doctor? How does this work? Like what?
So not at all, and that's the beauty of medicine. Because we work well with our colleagues
Right.
and we know how we're providing care, we're able to be kind of integrated in between PCP and hospital care. So you have like the urgent care space, which kind of combines a little bit of both sides of those 2 rounds of medicine. And so we inserted ourselves as one of the connectors. And so we do talk back to the PCPs, let them know what's going on with the patients, and have that interchangeable data.
So this is like no more interoperability. You're getting it right. No
That's
more
right.
calls and go 8 o'clock in the morning and call to
Exactly.
see if you can get to see a doctor. No more ER visits.
That's
You're
right.
getting people real time, access to those decisions.
That's right.
Exactly.
And this should be a $100 million raised company, right?
Right. Well, that's what we're hoping. So, out
Yeah.
of full disclosure as well too, I serve as the CTO
Yeah.
for her company as well too, and we're actually co-presenting today
Cool.
on what she is doing and how that's impacting the aging community as
That's
well.
awesome. So
Yes.
this is part of this age tech
Yes.
innovation that your
Exactly.
conversation you're doing today.
Absolutely.
Wow, that's
Yeah,
awesome.
Yeah. So, and the beauty, because I personally, I'm not only the CTO, I'm a user of the service
Yeah.
as well
Yeah.
too. I had a sinus infection and I couldn't get to my PCP in a timely
Yeah.
manner, so I reached out
Yeah.
and went online, used the service, and was
Yeah.
able to get antibiotics e-prescribed at my local pharmacy.
Oh, wow.
Through her services.
So I'm in Virginia. Can
Yes.
I do your app?
You absolutely
Okay.
can.
Yes.
So
Cool.
we cover the 50 states, Guam and Puerto Rico. And
Yeah.
so we're able to have our physicians, dedicate their time. We have a lot of different specialists because our colleagues and friends are in different,
Right.
specialties within medicine.
Yeah.
And so they loved what we were doing. And we all had
Yeah.
the experience where we did the same thing for our own family members.
Yeah.
And so we don't think that should be a barrier
Yeah.
to having that kind of access to care.
Yeah.
And so we broke down that barrier and said, this is what we're going to provide to the country.
So not
Exactly.
only we're really lucky because we have like an engineer at heart before a doctor.
Right.
Your doctor and engineer geek before is all
That's
rolled in, and that's why we
exactly.
got this. And then a real I need to help my family. And
Yes.
wow.
Yes, absolutely.
Absolutely, and the beauty about the service as well too. Not that I'm trying to do an elevator, but I am. I'm kind of
Yes,
trying to do one.
yes, do.
Is the price point for it too?
Mhm.
So you want to talk about that as well?
Yes. So when we were thinking of the model and how we were going to, structure it, we wanted price not to be another barrier to care. And so because it's text-based and it is so efficient use of your time as well as the physician's time, we were able to get the price point down to $35 per consultation. And so that fee was so accessible to those who are underinsured, uninsured, or even
Yeah.
undocumented
Wow.
and had no access to care.
I love that. So is it an app? Is it how does this work? How do I find it? How do I get on it?
Right.
So currently we are a web-based app that is on askmeyourmd.com. You can Google us, and that's the easiest way to find us. And it's a one-click, one payment, and you're connected within 30 seconds to our live physician to hear about what it is that you're needing, addressed at that time.
Absolutely. And what I love about the service, not only just the price point, but we're meeting the patient at the lowest common denominator of technology.
Yes.
Really, the cell phone and texting,
Yeah.
Yes.
which
Yeah.
99% of people do already.
Yeah.
And so
Yeah.
it's really a simple, easy way to have this conversation with over 25 different specialties
Yeah.
that they can tap into. And the other beauty about that, it's not just for like urgent care. Let's say I've already gone to a doctor and I'm looking for a second opinion.
Yeah.
Yes.
Yeah.
I just want someone to say, does this make sense, or are there other options available to me? You can literally tap into that service and get a second opinion for $35.
Yeah, I'm thinking of the $35. It's like if I can get pizza for family or
Right,
whatever
right.
meal at
Correct.
wherever
Exactly.
fast service
Right.
at Chick-fil-A,
That's
I
right.
can get your solution.
Exactly.
That's awesome.
It's really powerful.
Cool.
It's really powerful. So,
So glad you came on.
Yes.
Thank you for having
so
us.
excited to be a part of the journey with her as well too, and looking for big things to come. And yeah, we're looking for that IPO. And
I
Yeah,
know,
I
yes.
mean it's really
she's
it's
got a real.
and I'm glad we were able to get you
Yeah.
before you go on to your conversation today, your
Yeah.
talk.
Yes.
Yeah, thank you for
Yeah.
so much.
Thank you.
Yeah.